So I figured I'd do a bit of a vlog and just a description of events regarding my traumatic broken jaw, basically. When I was researching it myself, there really wasn't much I could find on YouTube. Um, and I saw on Reddit that there's a massive community for jaw surgery. I think it's literally Reddit/jaw surgery. Um, But when actually looking at that, like 99% of those surgeries were for cosmetic reasons. So or like teeth reasons. So like an underbite, an overbite. A lot of men get it done to bring their jaw forward to give them more of a jawline, stuff like that. Um, So that wasn't really relevant to me. So my jaw surgery was entirely due to trauma from a road traffic accident. So I'll just go through that now, and then I'll show you the X-ray I had because I had ORIF, basically plates and screws. So basically, I was on a motorbike, had a full-faced helmet on, car pulled out, hit into the car. And I guess despite wearing a full face helmet, the impact was just too much, and I fractured. I think I had four fractures down here, including the condyle. So I'll just show you the X-ray now, as well as the scar after that. I managed to get at the hospital, and yeah, it's not the clearest. They obviously have far clearer images there, but it's just all I could get at the time. But it gives you some idea of what the damage was. So, if I remember right, there was at least one fracture of the condyle, I think it's called. Let's just zoom in and have a look. So, that's obviously up just in front of your ear. That's basically the hinge area that the jaw swings from. And it looks like I think that's the start of the plate. It kind of looks like a bicycle chain, but obviously like a straight, rigid bar. But it looks like a bicycle chain, and then they put bolts through the holes you can see here. So you got one fracture there. Looks like possibly one here. Big one there, and it's hard to say because the image is so blurry. But it looks like there could be one. Most likely, there is one going across here as well. So yeah, this obviously the left side. The right side was fine. Like there was no damage done. Didn't lose any teeth at all. But obviously with this big break, it did affect my bite. So yeah, that just gives you a bit of a visual representation of what I had done. And yeah, I'll just show you the scar now as well. Yesterday at uh, about 5 weeks and 6 days since surgery, um, and that's literally it. So if you think back to the picture I just showed you, the X-ray/CT scan, there would have been a break round about here, well, a couple of breaks around here, and then one or two more, probably somewhere around this area. And all they did was this one incision. So the scar is obviously still quite new, and I wouldn't say it's raw, but it hasn't kind of faded and matured. It's still in the inflammatory phase, basically. So there's still some redness there, but over time that will kind of flatten out and go white, maybe a bit shiny, and then go like a dull white. Um, I regularly use alhydrin cream on that. I'll leave that in description because it's the only scientifically proven cream out there to really aid with reducing scar adhesion as well as making sure it stays flat and hydrated, because when it dries out it can get raised and quite angry looking. So that's what I use on that all the time. But if you look here, that's probably about an inch and a half. When I feel it with my finger, yeah, it feels about an inch and a half feels about right. So obviously I'm clean shaven here. If I let the facial hair grow, you can kind of see, because I used a dry shaver, which isn't very good, but you can see all the hair here would kind of cover it. But I purposely clean shave just to see how it would look. Face on, you can't see it because it's hidden behind the jawline here. But obviously from the side you can see it. But over time that will fade. So yeah, it did kind of confuse me a bit because so many people have read online when they have jaw surgery, the surgeon goes in from the mouth. So like in the mouth into the cheek kind of area from the inside. Whereas my specialist surgeon, who's apparently one of the best in the country for the type of operation I needed, he literally just that one incision and somehow managed to screw in bolts all the way down here. No idea how he did it, to be honest, but there we go. So yeah, I hope that helps. So that'll give you some idea. So immediately after the accident and leading up to the surgery, to be honest, it wasn't that painful at all. But as soon as it happened, I knew something was wrong because all my teeth on the left were meeting when a bit down, and none of them on the right were, and I could just feel that everything had kind of shifted this way. So the bite was completely off, which I noticed straight away. But again, it felt a bit tender, like around here where the breaks were, but it wasn't particularly painful, which was kind of weird. So I got into the hospital on August 9th, and they had to get a specialist surgeon to actually do the jaw surgery. So I didn't have the jaw surgery for 7, 8, 9, 10, 11, 12, 13 days after the break is when I actually had the surgery. So because like all the bones were just floating around in there was no risk of union and like the bones healing incorrectly placed, if that makes sense. So it wasn't like an emergency thing. I think it depends where your break is. There might be a higher risk of like damaging a nerve or something. I don't really know, but in my case, that wasn't a concern. So let's see. I think, yeah, it's been exactly 6 weeks today since the surgery. And you saw the photo anyway, but here's the scar. It's still red, but essentially, yeah, I'll just go through the surgical procedure and how that all went. So as I said, up until the surgery, there was no real pain, just a bit of tenderness. I knew the bite was off, and I was on a soft food diet leading up to it, because obviously you don't want to do more damage by eating really hard food. So I was put under for the surgery. I think it took them about 2 hours. And not to scare anyone, but when I woke up, I was in absolutely immense pain, like some of the worst pain I've ever felt in my life. And that's even with a morphine IV they gave me while I was under general anesthetic. So I came round, had this horrible, immense pain just around where they operated, and I was also on a fentanyl PCA. It's like a button you press to give yourself pain relief. So I had to spam that a few times until it finally calmed down. And after that, like as the days went on, the pain got less and less until it probably only took maybe a week for the pain to be from like a 10 out of 10 down to like a 3 or something like that. So yeah, your mileage may vary, but for me, when I first came round after the op, that was just like a really severe, horrible pain. But there you go. So since then, everything's healed well. Obviously, I've been on a soft food diet, so no like hard-boiled sweets and stuff like that. The only thing I have noticed, which is very common, and you'll read this on the subreddit as well, there's a nerve which kind of runs through, I think it's the lower mandible. I can't remember the name of the nerve. You'll be able to find it, but basically it's only a sensory nerve. It doesn't innervate muscle or anything, but when it gets bruised or stretched or damaged, you'll often have numbness on your lower lip, but only on one side. So for me, it's the left side here. And there's about a 50p piece size spot around here where it's quite numb as well. And the gums as well in this corner down here, that's all quite numb. That happened after the surgery, and the surgeon said it's very common, and it's often just where they're putting the plates in and drilling and whatnot. Sometimes the nerve can get pulled, and he said that the numbness should go away over time. For some people it can be as short as like a month, others it can be about 3 months, and then others it can be up to a year or even longer than that. It's a weird one because it's numb, but if I dig my nail into the skin, I can feel it. It's just an odd sensation. And in 6 weeks' time, I'd say maybe it's got a little bit better, but not massively, I don't think. But everyone's different, but it's quite a common thing to happen, so you do need to prepare yourself for that. And you just have to accept that it's possible that it may never feel normal like it used to. That's just the way it is. The other thing to note is directly after the surgery and ever since really, you will have swelling. I'll just show you a picture of that now because my swelling was immense. So it looked hideous really, like a big tumor coming off my face. But yeah, so that's how I looked. I think that was a day or two after surgery. That swelling will gradually come down. I would say after 2 weeks, most of it had gone. And now I'm at 6 weeks. I feel like there might be like 5-10% left, but I'm not really sure. I guess my face looks fairly symmetrical, but another thing to note really is that when I see myself in the mirror, I feel like I do look a bit different compared to before the surgery. This side still looks a bit wider to me. To everyone else, it probably looks normal, and some asymmetry is normal anyway, but I see myself every day, and to me it just looks a little bit, this whole area just seems to come out a bit more, but maybe there is a bit of swelling, I'm not really sure. I also feel like my mouth kind of slopes to one side, a bit like that sometimes, but I don't know. It's just something I thought I noticed, but I might just be being paranoid. What else should I go through? So pain-wise, I was put on as I said, after the surgery, I was put on a soft food diet for up until my most recent appointment, which was at about 5 weeks post-surgery. They said I can eat pretty normal now, but if it's something really tough like a boiled sweet, just be careful. And really, you're probably better off avoiding it until the bone is fully remodeled, which is at about 3 months. Pain-wise, it doesn't really give me any issues though. Very minimal, maybe like a 1 or 2 out of 10 pain at times, but at the minute it feels normal. There's no pain at all. So another big thing to bear in mind is it's quite possible that all your muscles surrounding the jaw and the face will be quite tight or weak following surgery. So for the first 5 weeks, they didn't really tell me to do anything with regards to physiotherapy. They just said kind of make faces while you're doing nothing, like that kind of thing. Just silly faces to get all the facial muscles working again. But one thing which is very, very common, almost guaranteed, is your ability to open your mouth is going to be reduced. So with me, I could barely get 2 fingers in like that. and trying to force it anymore would get a really painful kind of pulling of the muscle around here. So at 5 weeks, because I'm in the UK on the NHS, I was given one of these. This is called a Therabite. This camera is mirrored, but it's called a Therabite, which I got for free. You can buy them online if you're in America or whatever and your insurance won't cover it. They're about £400. I'll leave a link in the description to where you can get one, but this is an absolute godsend. It makes the physio so much easier. So you might be told to just use your fingers to kind of go like that and pull your jaw open, but this just makes it way more comfortable and easier. It's a very simple device. I've only been using it for about 4 days now, but essentially if you look here, you can stick a pen or something to pull this peg out, and you can set this arm starting from the lowest one, which I did here, and essentially you put this in your mouth and then push down like that, and it carefully prizes your jaw open. In fact, I'll show you now. So it comes with a bunch of these pads which are replaceable. They're kind of like a soft foam, and they stick on. And then also you have this screw thing. So say if you set it on this position 3, and if you push this all the way down, you can't tolerate it. If you let go, you can start doing this up, and it kind of limits how far this opens, and then you'll work your way up until such a point where you can go on to the next hole up, if that makes sense. So basically put it in your mouth, to film. And I do 5 sets of 30 seconds every 2 hours. When I started this, I found that this hole was too easy, so I started on this hole, and after only 2 days I could bump it up to this hole. So it has a measurement thing here, so you can track your progress. It also comes with a little logbook where you can write down your exercises and take measurements and whatnot. So this is at about 35 millimeters opening. The average human should be able to get to 45 to 50 millimeters, which is right at the bottom here. So I've still got a ways to go. Got about another 2 centimeters to go before I'm back at normal. So yeah, that's basically what I do. This is a brilliant device. But what I will say is it's cheap plastic, right? I mean, let's not sugarcoat it. It's not a precision device. It's a bit of plastic with a spring in it and 2 mouth guards. £400 to buy this privately is absolutely insane. But medical equipment just is expensive for some reason, despite this being like, someone could probably make this with a 3D printer in like a day. I'd imagine this costs maybe £5 to make in China. I bet you it's made in China. Don't quote me on that, but I bet it is made in China, for like barely any money at all. But yeah, going off on a tangent. So I'm very happy that I was just given this for free on the NHS. If I had to pay 400 quid for that, I wouldn't be very happy. But with that said, I would say it's worth it. Because when you're trying to prise your mouth open with your fingers, you'll get to a point where your teeth are just digging into your fingers and it's too painful to apply the amount of force needed to just rehab the muscles. So yeah, just pushing down on this just makes life so much easier. So yeah, if you're in the UK in an NHS hospital, I mean they're all NHS, aren't they really, other than Bupa and that, really push for one of these if they can get you one. It's called a Therabite, Therabite. Bite. Because chances are, if you've had ORIF on your jaw, you are going to have limited mouth opening. So, as I said, I started with about 2 fingers, and even that was difficult. Now I'm at about 2.5. So, like, that's where I'm at. So, yeah, I think that's about all I needed to talk about. As I said, I'm at about 6 weeks post-surgery now. I think I'll do another update maybe in another 6 weeks' time, so it'll be 3 months total since the surgery, and we'll see how we go. One more thing I will note actually is directly after the surgery, only my 2 teeth on the right here touched when I bit down, and I was freaking out thinking, oh, the surgery must have gone really badly, they didn't align it properly, my bite is completely wrong. Don't panic, it's all due to the swelling. Like, you'll have so much swelling and your jaw will be all out of alignment, which is normal. Over the coming days, more and more teeth on the right side started to touch when I bit down. After about a week, most of the teeth on the right were touching, but still none on the left at all. And I was really starting to worry. Then over the course of like another week or 2, I started feeling my front teeth start to meet when I bit down. And then over time, gradually the teeth on the left all started to meet as well, until basically now my bite is completely normal. But I'd say it probably took a solid month before my bite felt normal. So I'll show you it if you're interested. So as you can see, there are tiny gaps between the teeth, but most of them touch normally, especially the molars at the back. So you can see here and that side. And the surgeon said over the course of about a year, your teeth will move very slightly, like not like fractions of a millimeter, that they will move and your bite will get better and better, which is just normal. That's just what happens. So the only time that wouldn't happen is if your surgery went completely wrong and the jaw was just way too far out of alignment. Like, the teeth can only move and compensate a pretty small amount, so it needs to be fairly correct from the get-go, or that's not going to work. So that's basically it. Regarding the swelling and whatnot, it did feel uncomfortable to bite down fully and like push down with some force. That did feel uncomfortable and got gradually better over weeks until I'd say about week 4, midway through week 4, and then it felt normal. So now I can bite and it feels fine. So yeah, the TLDR version, I'd probably say by week 5 you should have a massive improvement in all your concerns, your bite, your swelling, your discomfort when you like apply force in your jaw. All that should improve to a pretty almost normal level by week 5. As for the scar, I just use alhydrin, which is clinically proven to be very effective on scars, to promote healing, reduce scar adhesion. It's SPF 30 as well, and just keep it moisturized. I just apply this 2 or 3 times a day, massage the scar lightly to prevent any adhesions, and that's basically it. Sometimes I'll stick a bit of scar tape on it, but not always. So yeah, it's such a minimal scar, I'm not really fussed. I'm more bothered about these scars, which are also from the injury, from the accident. The driver's door glass smashed and it cut up all my neck there, but over time they'll all heal. So yeah, it's a bit long-winded. I've not really structured this in a particularly good way, but hopefully I covered all bases. And yeah, hopefully this helps someone out there, because as I said, there's not really much info on the internet from the patient side when it comes to broken jaw surgery as a result of trauma, as opposed to elective surgery. So yeah, hope this helps.